Hello everyone, I'm Dr. Tirunelveli and welcome back to our initiative, What After Dentistry. As you all know, we are a team of dentists with healthcare management background and we are here to guide you and make you aware of the various career options in dentistry and healthcare. Today, we have with us Dr. Alex Mathews, a consultant prosthodontist, implantologist, and principal of Rajas Dental College and Hospital, Tirunelveli. So, sir, before we get into the discussion on laser dentistry, we would like to know about your journey. When you passed out, were there any struggles? Because we generally feel that older generation, they didn't have any kind of struggle. It was easy for them to make their mark in dentistry. So how it was in the earlier days, or what were your achievements and how has been your journey so far?
First of all, I would like to tell each and every one of my participants or listeners that always through dentistry or be that any field, is always limited only by our thought process.
So how did you develop, interest in laser dentistry? You had already done prosthodontist and then implantologist. Why laser dentistry, and what made you to choose this field?
Actually, my entrance into laser dentistry was perfectly by chance. I would use the word serendipity.
Please, sir, please tell our audience about this field. What is laser dentistry? What are the benefits of using this in daily practice? And how can one pursue this field?
If you were to take yourself, you won't believe it. Laser dentistry, and this is actual research that is happening in King's College London, where you can Google this. Each one of our participants can Google this. There is something called OOOKP, which stands for Ophthalmo-Odonto-Keratoprosthesis. Ophthalmo-Odonto-Keratoprosthesis. What you asked me in terms of the pros and cons is that one of the cons is that
it's very important, as sir said very correctly, that if you want to work, as a laser dentist, then it is very, very important that you get trained first. Become equipped with what and how to use it in your daily practice before just buying the kit and then start working on it. It's very, very important that you start your training process whenever you want to get into laser dentistry. And it's, as sir very correctly said, it's minimally invasive, it's painless, and of course it has more advantages than disadvantages if you use it correctly in proper, with the help of proper guidance and training. So sir, we would like to know that who can pursue laser dentistry? Can a BDS fresher pursue laser dentistry, or it is something that once you work in the industry and then you gain some years of experience and then you pursue this field?
So again, a wonderful question from you, Dr. Shireen, because you seem to be concentrating directly on the key issues that one faces in practice. A lot of times after BDS, I get questions from our house surgeons. So what do I do next? There are three areas which I direct them to. One is, are you going into practice? What would you like to do? Would you like to set up your practice immediately, or would you like to go on and refine your learning further to your own chosen area of specialization? Would you like to do that, or would you like to just go into practice right away? If the house surgeon, or if my young colleague were to tell me, sir, I would like to put up my practice because I feel that I need to contribute to treating patients, and I need to go ahead and go put what I learned into practice, I always tell them, absorb certain tools, absorb certain skills, which can set you abreast of the common competition that you would have in your area of where you're going to put up your clinic. And first, if you're going to do that, I would say that the first thing is to absorb certain skills. What are those skills? First, you could do a course in implantology. You could do a course in laser dentistry. You could do a course in perhaps aesthetic dentistry, or you could do a short course in endodontics, or you could do a short course in orthodontics, as my young colleague Binoy Ambukan does that on orthodontics. Dr. George Jacob is one of my colleagues in Cochin. He's already had around 150 or odd advanced courses in endodontics. These courses, what do? You've already learned endodontics, right, in your BDS. You've already learned endodontics, but you're learning advanced endodontics. You're learning it to a greater detail. You've already learned all aspects of dentistry, but if you learn laser dentistry, you can apply laser dentistry to making each aspect of your practice of dentistry more specifically, more precise. Let me just tell you, orthodontics, you just were to do fixed orthodontics, and immediately after activation, the patient will have pain. The patient will have pain, and usually our thought process is, let's not give analgesics in the immediate context because analgesics slow down tooth movement. Okay, so what are we telling your patient? You're telling your patient, try not to take those medications, try to bear up with it. But let me tell you, if you were to apply photobiomodulation, if you learn laser dentistry and if you apply photobiomodulation, not only can you speed up the rate of tooth movement, but also you can alleviate the patient's pain, which is a primary focus of patient's discomfort. In addition to that, so what I'm trying to say is that laser dentistry has an application to every branch of dentistry. Okay, so I'm just giving you an example. I told you about snoring there. I told you about tongue tie being a feeding problem in infants there, where you can correct with laser dentistry. With otherwise a feeding child, if you were to do a surgery and if you were to suture that area, how would the patient then suckle? The baby would not be able to suckle until you remove the sutures. With the sutures poking there under the tongue, the baby would not have any semblance of normalcy. But you can achieve that with laser dentistry. Now, another aspect I said is about implantology. If a general dentist, a boy who's just passed, or a girl who's just passed BDS, if he were to learn implantology, he can give patients who have got extremely resolved mandibular ridges, and if you were to be wearing complete dentures, perhaps they would not fit. Okay, and particularly with his specialization only at the BDS level, he will not know how to perhaps get a superb fitting mandibular denture. But if he's learned implantology, 2 implants, interforamina area, most safest area, interforamina area, that is between the mental foramina. You put in 2 implants, and I'm just simplifying it, I know, but I'm just giving an example here. My point being that he learns the tools through implantology to rehabilitate a patient who otherwise he may not have been able to give the best treatment for. So that gives, so what I would say is that if a child who's just passed out, or a practitioner who's just passed out BDS, if he were to learn implantology or laser dentistry or aesthetic dentistry, these gives him additional tools to set him abreast or set him ahead of the common competition that he would face, and it would give him the skills to achieve a greater level of perfection and a greater level of success. So that is about the first aspect. The second aspect is whether you would go for MDS in a chosen area of specialization. See, the more you specialize, man is a specialized being. The more you specialize, the more difficult it is to go out from that area of specialization downward. Okay, you will need to concentrate, look ahead, and go forward in that particular field. If you're going in prosthodontics, I would say you should, there is a lot of ramifications again, maxillofacial prosthodontics, implantology and prosthodontics, fixed prosthodontics, neuromuscular dentistry. There's a lot of applications there. Professor Prafulla Tumathi has proven how he has used neuromuscular dentistry and occlusion as a area of refinement, where he's be absolute master in India and abroad. So that's the second area. The third area I would say is, as I told you in my slides about the ophthalmo, odonto, keratoprosthesis, you can go into research. Now, stem cell research has actually shown that even the teeth can be rebuilt, Okay, this is not science fiction. King's College London is actually working on it. And these are areas where we can work. National University of Singapore is also showing a great deal of promise in terms of the research applications into dentistry. And these are the three areas. So if you ask, coming back directly to your question, Dr. Shireen, is that of course anyone who's completed her internship or is in due course of completing their internship in a few months can join for any of these courses and of course benefit to a great detail to go on further, Dr. Shireen.
I think that's amazingly you put it for all the students. So if you are into internship, you're about to complete your internship, or you have completed internship, you can pursue laser dentistry. So there's no hard and fast rule that you have to work in the industry or you have to pursue MDS, and then only you can specialize in laser dentistry. You can do it right away while you are doing your internship, or you are just about to complete your internship. So anyways, you can always become, or you can use lasers in dentistry. Of course, you need to get trained for that. And our next question lies in the terms of training only. So we would like to know if there are any master courses available in India. As you said previously, that in India, we don't have such courses. But since you also conduct courses on laser dentistry, would you please highlight if somebody wants to pursue a course in laser dentistry, from where should they pursue it?
I'll just share my details there. I would like each of my participants to perhaps they can email me further on this. You can visit the University of Genova's webpage and also our Facebook page. At present, because of the pandemic, we have our programs are all closed now, or concluded programs have been concluded as recently as in 2021 early part, that is in Feb, March. And we are yet to open up, but one of our centers definitely will be Raja's Dental College in Tirunelveli in Kanyakumari, near Kanyakumari. Dr. Shireen asked about the courses as such. We have 3 tiers of courses in laser dentistry and in implantology. We have basically 3 streams of learning. The first stream is on laser dentistry. The second stream is on implantology. The third stream is on dentofacial aesthetics. That includes smile design and also Botox and fillers and chemical peels. And we have an upcoming 4th field, which is advanced endodontics, which is also coming up this year. And in these 4 fields, we have 3 tiers of learning. The first tier is a basic accreditation program. The basic accreditation program is a 2-day program where you are given the basics or the basic foundations into learning laser dentistry, implantology, or facial aesthetics. Okay, what is conveyed in this courses? Let me tell you. In the basic courses, we give you only the basic. You will not be able to, because of time constrictions and also because of the theoretical constrictions that we are able to cover in just 2 days or 3 days. We will be only teaching you the basic theoretical aspects and will be only able to give you a demo. Okay, on a live patient. We will be able to give you a demo on a live patient, and we can say if it's implants, we can give you a demo on a live patient, and we can also allow you or get you to place implants on styrofoam jaws, artificial substrates. Okay, if it's lasers, you can use the lasers on artificial substrates such as a sheep jaw, or pieces of meat, or vegetables. If you're doing in Botox and fillers, you will be given a demo on an actual patient, and you will be given actual simulations can be done. That's all. You'll not be able to. You'll not get the chance to do the actual injections because of the time constraints, and also because of the theoretical foundations that we will not be able to take you in just 2 or 3 days. So that is the basic accreditation. The basic accreditation just gives you a basic certification into the know-how for the safe use of lasers. into the know-how, into the basic aspects of implantology, such as diagnosis and treatment planning, and basic aspects into how you need to safely place an implant, that is single implants, placement of single implants in single tooth missing sites, and injections of Botox and fillers or dentofacial aesthetic smile design, the basic aspects of it. The tier 2 is a multi-modular diploma program. What do we mean by a multi-modular diploma program? The multi-modular diploma program focuses on teaching you the deeper aspects of laser dentistry, implantology, and also Botox and fillers and smile design, in that you will be able to handle any case that comes to your clinic on your own without guidance. So that will have an advanced surgical aspect in implantology, such as sinus lift, JBR will all be covered there, starting from the suturing techniques. Okay, from in laser dentistry, starting from preclinical aspects into extracted teeth, and on the egg and things like that, we'll be taking you into advanced aspects, into including sinus lift, cutting the bone in sinus lift without damaging the Schneiderian membrane in the laser dentistry program, multi-modular program. When we go into Botox and fillers, we'll be going into actual injections of Botox and fillers, actual smile designing, actual work on chemical peels and fillers through different modules, so that you'll be able to handle cases on your own. Even in advanced endodontics, in the basic course, you will be just given this thing on bench work only, on bench microscopes of advanced endodontics. But in advanced cases, you will be actually treating patients. And we also are pursuing tie-ups with institutions such as Apurva Hospitals in Bangalore. We are looking at other universities also who are looking to tie up with us, such as one being Siddharth University in Tumkur, and we are having looking at tie-ups in the north also. But when the pandemic is over, definitely, Dr. Shireen, we'll be able to furnish you with greater details onto the areas where we'll be opening up in a great deal, and we'll be able to update you more. But for now, I would ask my dear listeners to just keep in touch with me on my email, visit the University of Genova's web page, and keep in touch with our Facebook page also, so that if you were to let me know your WhatsApp number and your email address, I will update you. The moment we have our first brochure, you'll be the first to come to know. And remember, we have a ceiling of participants in each program, because we always insist on not the numbers, we insist on quality education. So we insist on mentor guided training. We insist that each one of our participants be given enough time and attention by the mentors. So that's the reason why we have a ceiling of participants of only 20 per batch. So we would like you guys to let us know well in advance if you are interested in joining, and thereafter we can take it forward, and you would know first hand whenever we are launching. The third tier. So the first tier is basic. The first tier is the basic accreditation program of 2 days only. The second tier is the diploma program of multi-modules, which is 5 modules for implantology, 4 modules for laser dentistry, 3 modules for dentofacial aesthetics, and for advanced endodontics, again 3 modules. This is the tier 2 programs, which are diploma or fellowship programs in laser dentistry. All these programs, mind you, be that it's the basic accreditation or be that it's the diploma program, it's accredited directly by University of Genova, Italy, and the certificate is valid worldwide. And the certificate is also accompanied by a course transcript, which details what was the topics covered in each module, what was the topics covered by which all teachers, international and national faculty? What were the topics covered and what were the number of patients you had done? What are the preclinical work you had done? What is the score and grade you have got? Because you will be assessed on a cumulative grade points assessment, CGPA, which has a score from 1 to 10. It goes from C to A plus. And based on that, your certificate is valid worldwide. It is European Union accredited because the certificate has no mention on the local university or the local venue. The certificate only has the University of Genova logo on it. And so it is the same, whether you take it here in India, whether you take it abroad, it's the same. It has the university accreditation on it. It has the same design and layout, and it is assigned by the dean of the university himself. The third tier is the master's program. The master's program, Dr. Shireen, at present, we don't have the master's program in India because, again, we stress on not quantity, we stress on quality. The master's program, if one is interested in doing the master's program, you would be directed to University of Genova itself, where you will be allowed to pursue the master's program in University of Genova. But you will need to have either taken a basic accreditation or a diploma program to qualify for the master's program. The reason is not a question of us being hard and fast and saying, no, you need to do a basic accreditation program first. No, not because of that. Dr. Shireen, we have only 30 participant places for the master's program. For worldwide program, we have only 30 places in a year. We have only 30 places. So what happens, Dr. Shireen, is that when we get inundated, we get flooded by participants all over the world, from the Middle East, from Europe, from as far places such as Philippines, where people have, even in the last batch, we had a participant from Philippines. When they apply, we have to the tune of maybe 600, 650 applicants that comes for just 30 seats. So there's a great, there's a high level of filtration that goes along, screening that goes along. There's a screening committee that goes into seeing personally, into analyzing the merits of each application. And if you have not done a basic accreditation or a diploma certification, what happens is that you get filtered out. That's the reason why we are saying that. Not because we are saying that you have to be hard, and not because we are being hard and fast and we are being quite this thing on that only. No, it's not because of that. It's because the master's program is much sought after, and it's not easy to get an admission into that, and the screening allows you. So that's the 3 tiers I told you about. One is the basic accreditation 2-day program. The second is the diploma program, a multi-modular program, 5 modules for laser dentistry, 5 modules for implantology, 4 modules for laser dentistry, 3 modules for dentofacial aesthetics, and 3 modules for advanced endodontics program. And again, the master's program, which is also a multi-modular program, which is only in Genova. The master's program has got 6 modules, 3 modules each year. It's a 2-year program. Okay. The basic accreditation program is only 2 days. The diploma program is multi-modular, which is spread across 1 year, which generally takes around 6 months at least. And the master's program is 6 modules, which is spread across 2 years to complete. 2 years, 3 visits to Genova in a year, 2 years to complete. You will have to go directly to Genova. But to qualify for that, you need to either go through a basic program first and then through a diploma program again.
I think that's all the details I am sure all of you might have got. So if you're interested, do connect with Sir, and then you can take it up ahead. It's very important, as he said, it's very important to do a basic and a diploma program if you want to do masters, and if you want to specialize into any of these fields, as he correctly said. So please connect with him. I will link all his details in the description so that you guys can check out once you view the entire session. So, sir, the last tip or advice that you would like every dental graduate, especially the newer ones, because they are quite frustrated with the fact that there is no jobs, or dentistry in India has not much scope now. So what is the advice or tip that you can give to these graduates to motivate them and that they should follow to have a great career ahead?
Dear participants, dear colleagues, my dear friends in dentistry, do not be disheartened at all. You are in the most rapid advancing field in medical or allied fields today. There's a great deal of specialization fields out there for your choosing, according to your heart's area of choosing, according to where you would like to set your heart upon to continue that journey of sailing into the field of practice. So do not be disheartened at all. The first area which you need to think about is, first, as I did say during my lecture, whether you would like to go into practice right away or not. Would you like to either go into practice right away, or would I like to go and specialize in an area where I choose to specialize in? If you need to go into practice, my dear doctors, all you need to do is, you don't need to go into a 2-year MDS program. If you love to practice right away, please go and do that right away. When you go into practice, equip yourself first, so that you're confident, so that when a patient comes before you, your eyes exude with confidence that you're able to convince the patient to the particular treatment aspect. And how does confidence come, dear doctors? How does confidence come? Confidence comes when you know what you're talking about. Okay, so to know what you're talking about, equip yourself with the certain necessary skills that can set you abreast with the competition around you. Mind you, 80% of our practitioners, particularly the older practitioners, are doing only run-of-the-mill dentistry. Okay, they're doing what they practiced for the past 20 years. As I was 1999, so I'm a 1999 model dentist, right? But you are not. You are the latest. You've got all the technology aspects and all the learning aspects that you have today, which sets you much better than us. Let me tell you why. You know why? Because when we learned, all of these international editions were not available at all. Okay, we did not have the tools of learning you have today. All you need to do today is Google, right? All you need to do is go on and you get the PDF of an article where you want to read more on the particular topic. All you need to do is log on to YouTube. You'll find a lot of videos which tells you about details, the minutest details about how you can refine your practice, right? So if you have learned that, and not just from YouTube, not just from Google, as I did have a very good teacher in Dr. Suchetan Pradhan, Dr. A. Kumaraswamy. If you were to go in and find a mentor for yourself in your own chosen areas where you would like to, go into that specialized practice of, and you were to do that, then you are definitely going to set yourself apart. Dr. George Jacob, whom I mentioned as an endodontist practicing in Cochin, he only practices refined endodontics using the endodontics microscope. So he has specialized, narrowed down himself to certain cases of endodontics which are most tough and which are retreatment cases which others can't do. So there are areas which you can only do, others can't do, where you need to find that out. If you choose that to find it out, doctor, it's there for you, waiting for you to set yourself apart. And if you're going into MDS, in each MDS specialization, dear doctors, there is an area where you can set yourself further apart. If you take orthodontics, you have the Invisalign and you have the clear aligners. You have, if you take into orthodontics, there are n number of practice advances which you can yourself specialize in. If you go into any field that be. Oral pathology, if you're taking it, I just mentioned about optical biopsies for you. Raman Spectroscopy, C.V. Raman was ours, right? Right? But those white men, they're quite ahead of us right now, right? We can continue the exemplary work that Dr. Raman did, because that Raman spectroscopy is now available for us for identification of optical biopsies. The machine is available. Can you tell me how many institutes in India or how many clinics have Raman spectroscopy as an identification? How many hospitals have optical biopsy? None. Can you believe that? Now you can do that. It might be you who's going to take that first step ahead. So please don't be thinking that is dentistry the end point. Is there is so much, it's so vast, there's so many ramifications where you are going to set yourself apart, where you are going to be one of a kind. Okay, in this let me also take a doctor, a young doctor I knew 15 years back or 12 years back, I suppose. A young doctor who had the burden of taking care of his family also. He had just lost his father, and he was at a crossroads whether he should do a MDS or whether he should go into an allied field. I told him that he can definitely go into allied fields, and he chose to go into medical informatics, okay, bioinformatics. And do you know what that young doctor is doing today? Okay, that young dentist is now a very confident man who goes around. He's seen India for himself. He's seeing the world for himself. He goes for world tours till the pandemic came. Okay, his name is Dr. Vipin Vasudev Pai. Okay, he and I had a small chat in a small village, a small mountaintop village called Virajpet in Coorg district of Karnataka. Now, that's my point there. He has not just stayed in dentistry. He has gone into medical informatics, an area where he is using his expertise, what he gained in dentistry. So, dear doctors, the world is waiting for you. And even after specialization, if you don't choose to specialize, don't even do an MDS. Go into research. There is a great deal of research opportunities open for you, including settling down, PR, permanent residency waiting for you in areas like the UK, and in areas such as in Canada, or in areas such as in Australia, where research people are much sought after. I've got a personal research assistant with me in Rajas Dental College, where I have I'm lucky to be the principal of where Dr. C.S. Senthil Kumar, he was offered an opportunity to work in Italy. It is very difficult to get an outside person to get a job in Italy, because I've been working with University of Genova for the past 10 years now. This is the 10th year. But he has got an opening from the University of Rome. So imagine how and where you can reach. Dr. Senthil Kumar, mind you, he turned it down and he's working with us in Rajas Dental College. Okay, that's his passion for research. So all you need is a passion. All you need is a belief in yourself. And all you need is a confidence in yourself that you can set yourself apart. Set your heart on something, follow that. And that's what I said in the beginning of the interview, just like from Harivansh Rai Bachchan's Madhushala, Rah pakadkar, theek chala chal, pa jayega tujhe Madhushala. So that's my message for you. There is an area waiting for you where you can set yourself apart. Please go ahead, and God bless you. If you set your heart with the passion to learn and with the confidence that you have from your learning, you will set yourself apart as a team leader. There is another individual, Deepal Mehta. Dr. Deepal Mehta is one of the India's leaders into aesthetic dentistry. He was my student in laser dentistry. He has not gone into laser dentistry. He went into aesthetic dentistry. That's the area of his choosing. That's his passion. And that's what his heart told him to go after. Just go after what your heart desires. And I'm telling you, you're going to be a leader. You're going to be a leader too. And one day you're going to be giving interviews just like this. Dr. Sharon would be there to interview, or someone else would be there to interview you. Okay. Thank you. God bless.
Absolutely, absolutely. As Sir correctly said, just follow your heart, do what you feel you're best at, and just specialize into it, gain those skills and master that skill. Eventually, you will definitely, lead to the path, or you will reach to your destination wherever you want to. So don't be disheartened. Dentistry is still not bad. It has huge scope, humongous scope, not just in India, but worldwide. So thank you so much, sir, for enlightening our audience today on all about laser dentistry and what they can do in this field. So thank you so much for coming on our platform and sharing all this wonderful information. This has been a really, really very well, very informative session that we had so far. So thank you so very, very much. And for all the
Thank you so
audience
much.
out there, yeah. So
thank you so much. And I just want to put in a word of thanks to Vipin Vasudev Pai, Dr. Vipin Vasudev Pai, who is, and also you, Dr. Shireen, for patiently having me on this interview. I thank you for having given me this opportunity and spending all this time for me. Thank you so much.
So it has been our pleasure, sir. It's honor to have great leaders like you to talk about, dentistry and the various fields of dentistry today. So all the audience, if you're listening to our session, thank you so much for patiently listening. Don't forget to subscribe to our channel to get so much of, information about dentistry and the latest advancements that are happening around. So please subscribe. It's absolutely free. Like and share this video in your network, because this might help out somebody who's trying to explore more about laser dentistry. So thank you so very much. I will see you in the next video. Until then, bye and good luck.